Hello.
My name's Christina, and I'm an MP student at NKU. Can you tell me what you're here for today?
My annual wellness exam.
Okay, and what's your full name and birthday?
Trisha Bear, 6/16/92.
Okay, what's the date today?
August 13th, 2019.
And where are we at?
Doctor's office.
And who's the president?
Trump.
Okay, perfect. So from this I can tell that you're alert and oriented times 4. You are appropriate for your stated age. We've already done the history, so I'm going to go ahead and get some vital signs. How tall are you?
5'7".
And how much do you weigh?
130.
Okay, so I can tell that your BMI is about 20, which is normal. Okay, so your blood pressure is about 120/60, which is normal. I'm going to check your pulse. Your heart rate is 66, which is normal. And respirations are 16. I'll get your temperature across your forehead real quick. 97.6. Okay, so we're going to go ahead and begin your head to toe exam. So I'm just going to start by looking at your head. Your head is normocephalic. I don't see any obvious deformities. So I'm going to palpate your skull and your scalp. Any pain anywhere?
No.
Okay, so I'm not feeling any lumps or bumps or indentations. Your scalp looks normal. There's no dryness or infestations. Do you have any frequent headaches?
No.
No? Okay. All right, so now I'm going to go ahead and do some facial checks real quick. Can you give me a big smile and frown and close your eyes real tight and open them real wide? Okay, perfect. And I'm going to go ahead and palpate your sinuses. Some pressure, but shouldn't be any pain.
No pain.
Any pain? Okay. And I'm going to go ahead and feel your jaw. Open up for me and go move your jaw right to left. Okay, good. I don't feel any popping or clicking. Okay, so now we're going to go to your eyes. So we're going to take a look with the ophthalmoscope. Okay, so I can see the red reflex and the optic disc. We can take a look on this side. I don't see any bulging. The vessels are intact. And the red reflex is intact on this side as well. Okay. So now I'm going to have you just follow my pen light into the 6 cardinal fields. Okay, and then just follow it all the way into your nose and back out. Okay, we're going to go ahead and check your pupils. Perfect. Okay. So I'm just going to look at your eyes. So the sclera is nice and white and moist, and the conjunctiva is nice and pink and moist. Let's see. So I'm going to go ahead and test your vision. So I'm going to stand about 6 feet away from you and cover one eye for me. And read the lowest line that you can.
LTFPH.
And cover your other eye.
LTFPH.
Okay, and both eyes?
LTFPH.
Okay, perfect. Do you wear any glasses or contacts?
No.
Okay. All right, so now we're going to go ahead to your ears.
Okay.
So I'm just going to first start by inspecting. I don't see any obvious deformities, no trauma, no bleeding on both sides. And I'm going to palpate any pain when I touch the pinna or the helix.
No.
Okay. And I'm going to go ahead and take a look with the otoscope. So I'm going to pull the pinna up and back. And you can see the tympanic membrane is intact and it is a pinkish gray color. There's no drainage. Okay, again, there's no drainage. The tympanic membrane is intact. It is a pinkish gray color. Okay, so now we're going to do a couple of hearing tests. So first we'll start with the whisper test.
Okay.
So I'm going to whisper something in each side and you just tell me what you hear, okay?
Baseball. Apple.
Okay, so now we're going to do the Rhine and the Weber test. So the Rhine, I will put it in 2 positions and you just tell me which position you hear the tuning fork sound the loudest, okay?
Okay. The second position.
Okay, and the other side.
Second.
Okay, perfect. Then we're going to do the Weber, so I'll just put it on the top of your head and you tell me if you hear it equally on both sides.
Okay. It's equal. Same on both sides.
Okay, perfect. Alright, so now we're going to go ahead and go to your nose. I'm going to just look at your nose. It is symmetric. There's no deformities, no obvious drainage. I'm going to palpate. Any pain anywhere that I'm touching?
No.
Okay, alright, perfect. So then I'm going to look. Any trouble with nosebleeds or congestion?
No.
Okay. Both ears are patent. There's no discharge. And I'm going to have you close your eyes for me. And occlude one side. And tell me what you smell.
Alcohol.
Okay, and include the other side. And tell me what you smell.
Mint.
Okay, I'm just going to take again a quick look again. And the septum is midline, no deviation noted.
Okay.
Okay, so now we're going to go ahead and do your throat and your mouth. And just going to take a look inside. And open up for me. Okay, so the tongue is pink and moist, the buccal mucosa are pink and moist. You can see the tonsils are intact and the uvula. Go ahead and say ah for me. And stick your tongue out real long. There you go, perfect. Okay. So your uvula rises appropriately. And now we're going to move on to the neck. So I'm just going to visualize first. No obvious deformities. The muscles look normal. I'm just going to palpate your lymph nodes. Any tenderness anywhere?
No.
Okay. Okay, and then shrug your shoulders up a little bit. Okay, perfect. All your lymph nodes are fine. I'm going to feel your thyroid, so just swallow for me. Okay, and feel the trachea. It's nice and midline. I'm going to come around the back. And swallow again. Okay, perfect. Thyroid feels normal. Okay, I'm going to have you shrug your shoulders against me and turn your head towards my hand on this side. Okay, perfect. So now we're going to do your carotid pulses. So I'm just going to palpate them first. Perfect. That's +2 and regular. And +2 and regular. So now I'm just going to listen to them. Take a big deep breath and hold it. Okay, perfect. Okay. Now we're going to do some range of motion with your neck. So just put your chin all the way down, all the way back up, and then each side. Okay, perfect. All right, so now we're going to do upper extremities. Hold your arms out for me so I can tell that your skin is warm, dry, and intact. We're going to check your skin turgor, which is normal. I'm looking at your nails. There's no clubbing, ridges. They're not brittle. And cap refill was less than 3 seconds. Okay, I'm going to feel your radial pulses, which are 2+ and regular, and your brachial pulses, which are 2+ and regular. Okay, now we're going to do some range of motion. So I'm going to have you put your arms like this, push against me, and pull. Okay, perfect. And then we'll do some reflexes. So we're going to do your biceps, brachii reflex. Just relax your arm. Okay. And your brachioradialis and your radial. Perfect. And the other side. Okay. So reflexes are 2+ bilaterally. Let's see. So now I'm going to go ahead and just visualize your chest. It looks symmetrical. The AP diameter is 2:1. There's no lesions, bruises, scars on your chest. anteriorly or posteriorly. So I'm going to palpate. Just going to feel for any crepitus or abnormalities. Any pain?
No.
Okay. Come down the back. Okay. Any pain anywhere?
No.
Okay, so I'm going to go ahead and do a tactile firmness. So just repeat after me every time I place my hands on your back. 99.
99.
Say it again.
99. 99. 99.
Okay, perfect. And while I'm back here, I'm going to go ahead and listen to your lungs.
Okay.
Okay, and I'm going to percuss. Okay, so that is resonant, which is normal. And then I'm going to listen to the front. Okay, give me a couple more deep breaths. Okay, and under your arms. Perfect. Okay, so I'm going to go ahead and listen to your heart. So I'm listening to the aortic valve, the pulmonic, Erb's point, the tricuspid, and the mitral valve. Okay. So I'm going to have you go ahead and lay back so I can hear S1 and S2, which is normal. I don't hear any S3 or S4. Go ahead and turn your head to the right. So I'm just looking for any JVD, which I don't see, and turn this way. Don't see it there either. So I'm going to go ahead and palpate the PMI, which is at the fourth to fifth intercostal space, mid-clavicular line. Okay, now I'm going to go ahead and visualize your abdomen. So it is flat. I don't see any visible peristalsis or fluid waves. I'm going to auscultate in all 5 quadrants. Okay, vowel sounds are present in all 5, so I'm going to percuss. Okay, well, it sounds normal. And I'm going to palpate. You shouldn't have any pain.
No pain.
Okay, and then take a big deep breath in. We're going to do it a little bit deeper. Okay, take a breath. One more time. A little bit deeper. Any pain?
No.
Okay, perfect. All right, so no hepatosplenomegaly is felt. Bowel sounds are positive in all 5 quadrants. Okay, so now I'm going to go ahead and feel your femoral pulses. Okay, and I'm going to go ahead and just inspect your legs. Let's see, the skin is warm, dry, and intact. There's no bruising, no obvious deformities. I'm going to go ahead and check your pulses. Your posterior tib are 2+ bilaterally, and your pedal pulses are 2+ bilaterally. Okay, can you wiggle your toes for me? And push on me, pull on me. Okay, perfect. And yep, go ahead and raise that leg up, bend at the knee. Can you, move that ankle around? Perfect. And this one? Okay. And I'm going to check your Levinsky reflex. Okay. Okay. Okay, sorry, a little ticklish.
It's okay.
I'm going to check your cap refill, which is good. Okay. Then you can go ahead and have a seat here on the edge of the bed. And we're going to check your patellar reflexes. Okay. Alright, so now we're going to do some neurologic exams. So I'll have you put your hands on your lap and flip them over quickly. Tap your toes on the floor. Okay, excellent. And I'll have you close your eyes and tell me where I'm touching you.
Face.
Okay.
Arm. leg.
Okay, keep your eyes closed. We're gonna do sharp and dull. So this will be dull. This will be sharp.
Okay.
Okay?
Dull. Dull. Sharp. Sharp. Dull. Dull.
Okay, you can open your eyes. I want you to take your fingers. All right, perfect. And take your finger to your nose, touch my finger back and forth. Okay, switch the other hand. All right, sounds good. So now I'm going to have you stand up. I'm going to inspect your back, which all looks normal. Your spinous processes, they're all in alignment. Any pain anywhere?
No.
Okay, I don't feel any step-offs. Okay, all right, and lean forward. So I don't see any kyphosis or scoliosis, no tenderness anywhere. All right, now I'm gonna have you just walk over to there. Okay, and then come back heel to toe. Perfect. And put your hands on your hips for me and move side to side. Okay, and then just close your eyes and just stand still for a second. Okay, just keep standing still there for a second. Okay, so your balance is appropriate, your gait is steady, you're not wavering while you're standing there. And I think that concludes our physical assessment.
Thank
Thank you.